Hi everyone, this is Dr. Krishna Chaitanya, consultant spine surgeon, and we work on advanced spinal deformities usually in children. So this topic is how do we identify scoliosis at an early age. As all of you know, scoliosis is of different types like congenital, idiopathic and neuromuscular. Most of the children are below 5 years of age. If you need to identify them, usually it will be as congenital scoliosis. To identify there are a few techniques. The first technique is called as Adams forward bending test, where you ask the child to bend forward with his knees straight and arms touching the feet. So when you observe him from the back, you can see one side of the back, either left side or the right side, will be higher than the other. So this can be measured by using a scoliometer, or with a naked eye also we can easily observe that there is a scoliosis. The other thing is the shoulder difference. So if you can see these children, one shoulder, either the left shoulder or the right shoulder, will be at a higher place when compared to the other. So this usually happens in thoracic kind of scoliosis, where there is a curve in the thoracic spine. The other thing is loin. If you ask the child to stand straight and see from the back, one loin is above the other, or there can be a gap between the iliac crest, or that means the loin, and the hand. So if the gap is more on one side, you can easily say that there is scoliosis in this child. So why it's important to identify scoliosis? It's very important because if it's more than 10 degrees and if it is a congenital form, then it is very significant that this curve grows to around 70-80 degrees with growth of the child. So if you can identify such children at an younger age, you can treat them much effectively with very little risk. So that is the reason why we need to identify them at an early age. So unlike Western countries, in India there is no proper screening program for children in scoliosis. So usually it is better to identify them in school going age, where we screen for height and weight. At the same time, we will ask the child to bend forward, do a small very easy Adams bending test, so that we can identify any children who are having scoliosis which is not evident at that age. Thank you very much.